Welcome back guys. Now in this video let's discuss about the vascular disorders. Now before discussing about any vascular disorder, one should know the histology of a blood vessel. Please look here. Here I am showing you the histology of a blood vessels. Now you should know that the blood vessels are made up of 3 layers. Okay. So if you do the cross section and if you look under the microscope, how many layers are there for a blood vessel? Blood vessels are made up of 3 layers. What are they? See, the innermost layer of a blood vessel, which is made up of the endothelium. See, the innermost layer is called as the tunica intima, or the endothelial layer. Then the next layer, which I am highlighting over here, made up of the smooth muscles. This layer is called as the tunica media. First layer is called as the tunica intima, made up of the endothelium, and the second layer is called as the tunica media, which is made up of the smooth muscles. And the last layer, which is present, okay, the outermost layer of a blood vessel is called as the tunica adventitia. So tunica intima, tunica media, and tunica adventitia. So let me write it down over here. How many layers are there in a blood vessel? 3 layers. What are they? From innermost to outermost. The innermost layer is called as the tunica intima, made up of the endothelium. The tunica media, mainly made up of the smooth muscles, and the outermost layer is called as the tunica adventitia. Okay. Not only this, I want you to know between the endothelial layer, the tunica intima and tunica media, between tunica intima and tunica media, in between them, there are this wavy band of fibers. See, this is the tunica intima. For example, you look here, this is a green color one which I am highlighting. This is the tunica intima. In between the tunica intima and tunica media, there is a wavy band of fibers. Okay, let me highlight it with the red color. This wavy band of fibers which I am showing over here, this structure is called as the internal elastic lamina. Okay, the internal elastic lamina. So internal elastic lamina is something which is present between tunica intima and tunica media. Now you can also appreciate one more layer. See, what is this one? This is also a wavy band of fibers which is present between the tunica media and tunica adventitia. So this is the tunica adventitia layer, this layer. So this layer which I am highlighting right now, this is called as the external elastic lamina, internal elastic lamina as well as the external elastic lamina. Okay, here also you can see there are these 2 wavy band of fibers. One is the internal elastic lamina, this one internal elastic lamina, and this outermost one which I am highlighting right now, this is the external elastic lamina. Okay. Now let's begin with the first topic in the vascular disorders. The first topic is vasculitis. What is vasculitis? So vasculitis is inflammation of blood vessels. Okay. Now why exactly vasculitis? Why there is inflammation of the blood vessels? We exactly don't know the reason. The reasons are idiopathic. For most of the vasculitis, we know certain associations, but we don't know the exact reasons why vasculitis is happening. Okay. So etiology is idiopathic. And what are the types of vasculitis? Let's talk about the classification. This is most important. Classification of vasculitis. See, based on the type of blood vessel, based on the type of blood vessel to which the inflammation is happening, the vasculitis is divided into 3 types. For example, if the vasculitis is happening to larger arteries, then it is called as a large vessel vasculitis. If the vasculitis or the inflammation is happening to a medium sized blood vessel, then it is called as a medium vessel vasculitis. If the inflammation is happening to small blood vessels, then it is called as a small vessel vasculitis. So based on the size of the blood vessel, the vasculitis is classified into how many types? It's classified into 3 types. What are they? Large vessel vasculitis, large vessel vasculitis, medium vessel vasculitis, and small vessel vasculitis. Okay, so large vessel vasculitis, medium vessel vasculitis as well as the small vessel vasculitis. Now what are the examples of large vessel vasculitis? The 2 T's which you should know. Okay, so the large vessel vasculitis is of 2 types. One is called as the temporal arteritis. Okay, temporal arteritis. This temporal arteritis is also called as giant cell arteritis. Okay, so temporal arteritis is also called as the giant cell arteritis. They are one and the same. They are not two separate things. They are the same things. And the second T which I want you to know is called as a Takayasu. Takayasu Arteritis. So temporal arteritis and Takayasu arteritis, they are coming under the large vessel vasculitis. Under the medium vessel vasculitis, the examples which I want you to know are polyarteritis nodosa. Guys, please remember, not arthritis. Arthritis is inflammation of the joints. Okay, now I am talking about the arteritis, inflammation of the blood vessels or the inflammation of the arteries. Okay, so polyarteritis nodosa, which is also called as a PAN. Simply remember PAN, PAN. And the second example which I want you to know is Kawasaki disease. Kawasaki disease. And the third example which I want you to remember is called as a TAO. Okay, TAO, which is nothing but thromboangiitis obliterans. Okay, so TAO, thromboangiitis obliterans, this was the question asked. See, what is the other name? Simply, this was a question which was asked in one of the exam. TAO, thromboangiitis obliterans, is the other name for Buerger's disease. Buerger's, not Buerger's, it's Buerger's. Okay, Buerger's disease. And the examples of small vessel vasculitis, which you should know, are 3 in number. What are they? They are Wegener's granulomatosis. Okay, Wegener's granulomatosis. And the second one is microscopic polyangiitis. And the last one is Churgstrass. Churgstrass syndrome. So broadly, these are the type of vasculitis which I want you to know. There are 3 different types of vasculitis: large vessel, medium vessel, as well as a small vessel vasculitis. Large vessel vasculitis includes temporal as well as a Takayasu. Medium vessel vasculitis includes polyarteritis nodosa, Kawasaki disease, as well as a thromboangiitis obliterans. And the small vessel vasculitis, the examples are the Wegener's granulomatosis, Churgstrass disease, Churgstrass syndrome, as well as the microscopic polyangiitis. Now after this, after discussing about the types of vasculitis, the one important point which I want you to know is, see, this vasculitis, not all the vasculitis, but some vasculitis, they are associated with ANCA. Okay, they are associated with ANCA. So you can ask me, what exactly is this ANCA, sir? ANCA means anti-neutrophilic. Okay, anti-neutrophilic cytoplasmic antibody. Okay, anti-neutrophilic cytoplasmic antibodies, ANCAs. Some vascular disorders, especially small vessel vasculitis, some vasculitis, they are associated with this type of antibody within the cells. See, how many types of ANCA are there? There are 2 types of ANCA. Actually, there are 3 types of ANCA. But most importantly for your exam, these 2 types of ANCA are important. 2 types. What are these 2 types of ANCA which you should know? The 2 types of ANCA are P ANCA and C ANCA. So what does this P and C stands for? The P in P ANCA, it stands for perinuclear antibody. Okay, perinuclear ANCA. And C here stands for cytoplasmic antibody. C stands for cytoplasmic ANCA. Okay, simply remember, ANCA is an antibody. For example, if you ask me what exactly is this P ANCA, sir? Now look here. Now we are talking about the neutrophils, right? Anti-neutrophilic cytoplasmic antibody. Okay, let's draw a neutrophil over here. For example, if this is a neutrophil, we all know in the neutrophil there is a multilobated nucleus present. So if this is a neutrophil, now there is a multilobated nucleus which is present, something like this. Okay, not exactly like this, but similar. Nucleus will be there. Now, if the antibody is coming and sitting in this perinuclear region, okay, then it is called as perinuclear anti-neutrophilic cytoplasmic antibody. Both the antibodies are present in the cytoplasm only. But if the antibodies are coming and sitting in the edges of the nucleus, means perinuclear, around the nucleus, then it is called as perinuclear anchor. In the other way, if the antibody is coming and distributing evenly within the cytoplasm, okay, if it is depositing evenly in the cytoplasm, then it is called as cytoplasmic anchor. So, this type of P ANCA and C ANCA are associated, are seen in certain type of vasculitis. So, for exam point of view, you should know P ANCA is seen in which conditions, which type of vasculitis. Okay, see, P ANCA is seen in many other conditions also, but in vascular disorders, it is seen in what? Seen in which type of vasculitis? It is going to be seen in microscopic, polyangiitis, microscopic polyangiitis, as well as the Church-Strauss. This is the first one. Church-Strauss syndrome. Remember, both microscopic polyangiitis as well as Church-Strauss, that are coming under small vessel vasculitis. And the next one which I want you to know is C ANCA. This is something very important for your exam. Okay, the C ANCA, it is seen in one condition, it is called as Wegener's granulomatosis. See, I used to remember like Wegener's rather than Wegener's. Why? Because you should know that C ANCA is present. C ANCA is present in which type of vasculitis? Wegener's granulomatosis. Now, a question which can come in your exam is which type of ANCA is present in Wegener's granulomatosis. Remember, in most of the cases, in 75% of the cases, this Wegener's granulomatosis, it is C ANCA positive. Okay, it is C ANCA positive, which means 75% of the cases C ANCA is present. But in 25% of the cases, P ANCA is also present. Okay, so 75% of the cases P ANCA is positive, in 25% of the cases P ANCA is positive. So Wegener's granulomatosis is a condition where both C ANCA as well as P ANCA can be seen. Okay, now after this, let's begin with our topic, the main topic of the vasculitis. Okay, now in the vasculitis, let's begin with the large vessel vasculitis. And in the large vessel vasculitis, what are the examples? Temporal arteritis as well as the Takayasu arteritis. So now look at this image. There is this old female, okay, definitely 60 years or 65 years old. Now this female is suffering with severe headaches. Now if you look at this, the temporal region, if you look at the temporal region of these old individuals, you can see a dilated tortuous blood vessels. Okay, you can appreciate that these dilated blood vessels are present. Now this is a temporal artery, right? So they are suffering with which condition? They are suffering with a condition called as a giant cell arteritis. Now can you guys tell me what is the other name of this giant cell arteritis? The other name, let me write it here, the other name of this giant cell arteritis is also called as simple temporal arteritis. Okay, you can appreciate here the blood vessel, see the blood vessel is totally inflamed. Okay, the blood vessel is inflamed. Now this temporal arteritis, it is mainly seen in, or this giant cell arteritis is mainly seen in which sex? It is mainly seen in female sex. Okay, this is mainly seen in the females. In which age group? In 20-25 years? 30-35 years? No, they are mainly seen after 50 years. Okay, 60, 65, 70 years. Okay, mainly seen after 50 years, mainly seen in the elderly. Okay, not in young or middle age groups. Now after this, what are the clinical features? Okay, if you get this giant cell arteritis, already I have told you why it's happening, we exactly don't know the reasons. Okay, we exactly don't know the reasons. It's hypothesized that these might be because of some autoimmune processes happening. We exactly don't know, idiopathic. If you have this giant cell arteritis, what are the clinical features? The most common presentation, most common presentation is unilateral temporal, means on one side, and the temporal region unilateral temporal headache. Okay, and why especially in this area? Why? Because the blood vessel which is most commonly involved. Okay, the most common site or the most common blood vessel that is going to be affected here. See here, the most common blood vessel that is affected is superficial temporal artery. Okay, superficial temporal artery is going to be affected, and that's the one which is causing the headache. The superficial temporal arteries are getting inflamed, and that is causing the headaches. Now after this, superficial temporal, no, don't think that only superficial temporal artery is going to be affected. Many more arteries will be affected, but the most common affected artery is the superficial temporal artery. Now after this, facial artery can also be affected. Okay, so because of the involvement of the facial artery, okay, facial artery, you know, it's going to take a turn something like this. Okay, facial artery. Now, because of the involvement of the facial arteries, there can be pain whenever the person is opening his mouth, like this. Opening of the mouth will cause the stretching of the facial artery. The stretching of the facial artery can cause the pain. This is called as jaw claudication. So most specific presentation. So the most specific presentation is going to be, see here, the patient is having jaw pain because of the involvement of the facial artery. Okay, so jaw claudication, with the opening or the closing of the mouth, there is a pain. So this is called as a jaw claudication. Okay, now what else can be there? See, the multiple blood vessels can be affected. So there can be arthritis. Okay, there can be joint pain, arthritis can be there. These are the other presentations, joint pains. Okay, not arteritis, no, arthritis, involvement of the joints. Arthritis. So this is called as a polymyalgia rheumatica. Okay, so multiple joints are going to be affected. Polymyalgia rheumatica can be seen. Now, important point which I want you to know is, see, whenever you have a 50-year-old or 60-year-old with a unilateral temporal headache, when you look at, when you do the examination, there are the dilated tortuous blood vessels which are present over in the superficial temporal region, and they are saying jaw claudication, all the symptoms. Now, you are suspecting that this individual might be suffering with temporal arteritis. Now, one thing you should do immediately, do you know what is that? Start immediately steroids, aspirin. Why? Why? Because they are at a risk of vision loss. Okay, let me write it over here. See, they can have vision loss. Okay, why? Because this inflammation might spread to the optic nerve or the ophthalmic artery, and that can lead to the vision loss. So this is the most dangerous complication. So start steroids immediately. Okay, start the steroids immediately to prevent the blindness or the vision loss. So this is the one point which I want you to know. Now after this, to confirm the diagnosis, okay, to confirm, see, you can look at the histological picture over here. Because of the inflammation, you see why it is called as the giant cell arteritis. See, the giant cell arteritis is because when you do a biopsy, or under the histology, you can see giant cells. Okay, multinucleated giant cells are seen. Giant cells are nothing but the macrophages, right? The fused macrophages. So many giant cells are going to be seen in the blood vessel. So that's why it is called as a giant cell arteritis. Now because of this, what you can see is the narrowing of the lumen. The lumen of the blood vessels is going to be greatly narrowed. That decreases the blood supply. Now, what I want you to know is gross features. Okay. So to put the diagnosis, what you look in the gross morphology. On the gross morphology, you can see temporal area with the dilated So temporal region with, I have already shown you the image, with dilated and tortuous segmental nodular thickenings. Okay, so on the temporal region you can see a nodular thickening, segmental nodular thickenings can be seen on the gross morphology. But if you look under the microscopy, okay, what you can see, microscopic examination. But to do the microscopic examination, what you need to do first? You need to take the biopsy. Okay, you need to take the biopsy. See, here I am showing you, see the biopsy is being taken. Now for biopsy, here see, the explanation was also given, temporal artery biopsy. Now TAB, temporal artery biopsy, is performed in a patient from the case study. Now, the important point which I want you to know is, see, this involvement, the inflammation is not going to be continuous. It is going to be segmental, which means, see, for example, if this is a blood vessel, okay, if this is a blood vessel, see, certain part is going to be inflamed, but the other region is going to be spared, and again one more area is going to be involved in the inflammation and the other area is going to be spared. So there is segmental involvement. So for example, now if you take a biopsy in this area, okay, so if you take a biopsy in that small area, will you be able to look at the inflammation? Will you be able to pick up the diagnosis? No, definitely not. So what you need to do, see, small biopsies are not enough. You need to take a large biopsy. Okay, that's the important point which I want you to know. See, measuring to ensure adequate sample length. You need to take adequate sample length. It's not a small biopsy. You need to take a large biopsy. So let me write here. Microscopic examination. First, what you need to do? You need to do the biopsy of superficial temporal artery. What is the length? What is the optimal length you need to take? So the optimal length which you need to take is 3 to 5 centimeters. 3 to 5 centimeters of the biopsy you need to take. If you take the biopsy, what you will look under the microscope? See, it's a granulomatous inflammation of this blood vessel. It's granulomatous or non-granulomatous? Granulomatous, definitely. Okay, there are even multinucleated giant cells present. So on microscopy, what you are able to appreciate, it is granulomatous. Granulomatous inflammation. And one more important point, what you can see is giant cells. Okay, so giant cells are seen and granulomatous. So remember, temporal arteritis, also called as the giant cell arteritis, is going to be seen in elderly, but to females after 50 years. Now, what are the important points which you need to know regarding clinical features? Regarding clinical features, there is a unilateral temporal headache with a jaw claudication and a risk of blindness. So, start immediately the steroids. Start the steroids immediately. Okay, and to confirm the diagnosis, you need to take a biopsy, and the biopsy need to be done in the optimal length of the biopsy is going to be 3 to 5 centimeters. Why? Because it's a segmental involvement, segmental inflammation. Okay, not a continuous inflammation, segmental inflammation. Okay, upon doing the microscopy, what you will see under the microscopy? You will see multinucleated giant cells as well as granulomas. That's why it is called as a granulomatous inflammation. Okay, now after this, what I want you to know is, look at this image. What you are able to appreciate? See, definitely you can say this is the heart. Okay, and look here, this is a large blood vessel. This is the aorta, right? Okay, now are you able to appreciate that there is inflammation? See, all this aortic arch is going to be inflamed. So what is this disease? This is not temporal arteritis. Then what it is? The name of the disease which we are going to discuss is called as Takayasu Arteritis, the second type of arteritis. Okay, Takayasu Arteritis. Now, this Takayasu Arteritis is also called as, there is one more name. This Takayasu Arteritis is also called as aortic arch syndrome. Why? Because I have already shown you the aortic arch is going to be affected. Aortic arch syndrome. There is one more name. It is also called as pulseless disease. Okay, pulseless disease. Why it is called as pulseless disease? I will tell you. See, why it is called as pulseless? Because what is the most common blood vessel that is going to be affected? The most common blood vessel that is affected is subclavian artery. Okay, so subclavian artery is going to be affected. See, subclavian artery is a branch of aorta. So, the inflammation is now spreading to the subclavian artery. We know that subclavian artery is the one which is going into divide into different branches and forms the blood vessels of the arms, right? So, now whenever the subclavian artery is going to be affected, so what happened to the blood supply to the upper extremities? What happened to the blood flow? It is going to be decreased definitely. Why? Because there is inflammation, the lumen of the blood vessels is going to be narrowed. So, the pulse, the transmission of the pulse and the transmission of the blood flow is going to be greatly affected. So, whenever you check the pulse, it is going to be weaker. So, the pulse is going to be weaker, or sometimes you cannot feel the pulse. So, that's why it is called as a pulseless disease. Okay, so the most commonly affected artery is going to be subclavian artery. The most common site is subclavian artery. Now, second question. Temporal arteritis. It is going to be a granulomatous inflammation. So, what about this Takayasu arteritis? Is it a granulomatous inflammation? Yes, absolutely. So, it is also granulomatous inflammation. Okay, it's a granulomatous inflammation going to be seen in which sex? Again in females, but less than 40 years of age. Now, it is going to be seen in middle-aged women and younger age women, okay, 20-30 years. Okay, so it is going to be seen in female sex again most commonly, and that too before 40 years. What are the most common presentation? Most common presentation, MCQ, the most common presentation, and actually this is a keyword. Okay, rather than saying most common presentation, actually it's a keyword. Just with this you can say, see, the pulses are going to be felt normal in the lower extremities. The pulse is absolutely normal in the lower extremities, but the pulse is weaker in the upper extremities. Whenever you see such a case, then most commonly the examiner is talking about the Takayasu arteritis. So, the most common presentation is what? Weaker pulse in upper extremities. Okay, the weaker pulse in upper extremities. If you do microscopic examination, what you will see? You will see multinucleated giant cells as well as granulomas. That's already I have discussed that. If you do the microscopic examination, granulomatous inflammation is seen along with multinucleated giant cells. Okay, multinucleated giant cells are also seen. So, what are the important points about the Takayasu arteritis? We don't have exact reason why it is happening. Takayasu arteritis is going to be seen in females, but less than 40 years of age, and it is a granulomatous inflammation. And what are the most common blood vessels that are going to be affected? The most common site is going to be the subclavian artery. This is also called as the aortic arch syndrome or pulseless disease. Now, the patients are going to have the weaker pulses in the upper extremities, but the pulses are going to be normal in the lower extremities. So, with this, the large vessel vasculitis is completed. Now, in the part 2 of this video, let's discuss about the medium vessel vasculitis. Thank you.